Connor and Lacey Peterson's Autopsy Summary by Dr. Brian Peterson, no relation. He's the medical examiner who performed Connor's autopsy. He's a forensic pathologist employed by the Forensic Medical Group in Fairfield. The history provided to Peterson was that of a body found on the shore. Peterson did not know this was Connor, as the female body had not yet been found. Consequently, the typical forensic pathology question is the type in this case: is this a stillborn baby or a live-born baby? Initially then, Peterson was not concerned with explaining Connor's state of decomposition compared to Lacey's, because Lacey was not yet known about. The external exam of Connor Peterson. The external exam revealed no clothing since it was a fetus. There was some kind of material associated with the body, particularly some clear plastic tape, a lot like tape or boxing tape, 1.5 loops of plastic tape around the neck of the fetus with a knot tear near the left shoulder. The skin beneath the tape was not injured, and there was approximately 2 centimeters gap between the neck and the tape. When pulling the tape, it was so firm against the side of the neck, Peterson removed the tape by cutting it and giving it to the criminalist. Peterson concluded that the association between the body and the tape was coincidental. The tape simply ended up on the body. There was also some material over the left ear adhering to the head, which Peterson believed to be kelp or some other vegetative material. However, when it was removed, the ear remained folded over and there was a purple discoloration on Connor, which Peterson said is more consistent with the iodine in kelp than with bruising. Peterson is not the person who removed this material from Connor's ear. Connor was decomposing in general terms. He weighed 1,160 grams, approximately 2.5 pounds. A crown of head measurement could not be taken because the head was collapsing. Crown heel length was 48 centimeters, approximately 19 inches. Based on these measurements, Connor could have reached full term. The skin was quite soft, in keeping with the maceration and effect of the tissue soaking in fluid. No vernix on the body. The bones in the skull were overriding, which happens as the brain liquefies. There was a tear near the right shoulder that exposed skeletal muscle and the structures beneath. The tear extended onto the abdominal wall, and the portions of the small and large intestines protruded through the tear. There was no scalloping, no curved marks around the edges. Concluded it was simply from the tissue falling apart or being pulled apart due to tidal action. It wasn't due to animal feeding. Estimated gestational age 9 months based on the crown to heel and the crown to rump measurement. However, the body was soft and decomposing. As tissue decomposes, it tends to expand, and expanding tissues can affect the whole body. Peterson left the gestational age determination to Dr. Galloway, an anthropologist.